So let's delve into community-acquired pneumonia a little bit. We're going to talk about that into more in more depth about CAP. So when we look at community-acquired pneumonia, there are the common bacteria that we see is Streptococcus pneumoniae or pneumococcal pneumonia. Remember, when we have those cocci or cocci, these are round-shaped bacteria that you would see in your gram stain. And this accounts for 80% of all bacterial pneumonias. And these are sensitive to penicillin. So you can use ampicillin, penicillin, any of your cillins that you have, those antibiotics are good for these community-acquired pneumonias. So if you have a patient that comes in having signs and symptoms or clinical manifestations of pneumonia, we want to get them onto some penicillin as soon as we possibly can. So that is something that we really want to look at and delve into and make sure that those patients are getting the right treatment whenever they come to see us. This can transmit through aerosol. So a patient that coughs, patient that sneezes, even a huff can transmit some aerosol, and that aerosol will generate aerosol, and these bacteria can transmit through that aerosol. And we see this also with acute exacerbation with patients that have chronic bronchitis. So those blue bloaters that have an acute exacerbation, a lot of times it's secondary to a community-acquired pneumonia. Other kind of types or subcategories of the pneumonia is the Staphylococcus aureus or Staph aureus and Staphylococcus epidermidis, or Staph epi. So these are common that we see more so with hospital-acquired pneumonia and MRSA. These can transmit through aerosol, just like the strep pneumoniae categories, and they can also transmit through direct contact. So you can touch a surface and then just kind of wipe your mouth. The transmission is greater with these staph type bacteria more so than the strep. And this is common with kiddos and also with the immunocompromised. So we can see that with the hospital-acquired pneumonia and MRSA. So MRSA is methicillin-resistant Staph aureus. So it's a type of penicillin that this Staphylococcus aureus is resistant to. So we've got to find other antibiotics for these patients. Further going into community-acquired pneumonia, we have Haemophilus influenza. This is normal flora in your pharynx. So this is part of what you typically have in your upper airway. These are small gram-negative bacilli, so these are more your rod and your pink-colored rods specifically when you do a gram stain. There's six different types. 6 different types of Haemophilus influenza, Haemophilus influenza A, B, C, D, E, and F. And we see this with acute exacerbation of chronic bronchitis as well. So which one of the Haemophilus influenzas have we talked about before? And you might have talked about this in pediatrics. You may have talked about this with patients that have stridor or an upper airway disorder. Yeah, so this is most common when we have patients that have Haemophilus influenza B. So your croup is the answer there. Is when you have patients that have croup, most likely the source of infection is Haemophilus influenza B. Another type of community-acquired pneumonia is what we call Klebsiella or Klebsiella pneumoniae. This is going to lead to a lobar influenza. So when we have patients that have Klebsiella pneumonia, they have a very distinct characteristic when it comes to their sputum. It is like a jelly. So it looks just like jam, and it's pink and purple just like that, and it's thick and tenacious. And it leads to lobar pneumonia. And it's tough. It is tough. Like I said, it usually leads to a lobar pneumonia, and we see this with men that are older than the age of 40 with chronic alcohol abuse. Doesn't have to happen that way, but that's where we see an increase in your risk factors. This is a gram-negative bacilli, and it's actually normal flora in your GI tract. So this is a bacteria that is normally in your GI tract. And when it gets into your lungs and it creates a bit of an infection, it creates a bit of a storm with taking care of patients. I remember in my career, we had a patient that was on the vent for like a month with Klebsiella pneumonia, and she struggled to recover from just her time in the ICU. So when we see this Klebsiella pneumonia, we got to jump on it. We got to jump on it now. And they have some really tenacious, like jelly-like secretions. That's something that kind of stands out with the Klebsiella, is that jelly-like secretions. It can happen. You can transmit it through direct contact or through aerosol, and it really has a high mortality rate. So it's something that you want to jump on and you want to take care of as early as you possibly can. Further community-acquired pneumonias is Pseudomonas aeruginosa. Pseudomonas aeruginosa. This is a gram-negative bacillus. Usually we see this in the GI tract. It's common with burns or urinary tract infections. Trach patients have an increased risk for Pseudomonas. It is the leading cause of hospital-acquired pneumonia. So leading cause, anytime that you have anything that is the leading cause or the gold standard, you might as well just go ahead and circle that, because that is most likely going to be a test question of some sort. So go ahead and highlight leading cause of hospital-acquired pneumonia. It's usually we see this through contaminated respiratory equipment. So when we talk about the different levels of cleaning, and you go through cleaning, disinfecting, sterilization, all of those things, those are important because there is a bacteria that is out there that causes hospital-acquired pneumonia, and we already learned that it's the 8th leading cause of death in America. So why are we not being more vigilant about taking care of our respiratory equipment? All right, I'm off my soapbox. But when we talk about Pseudomonas, it has a certain smell to it. It's got a certain characteristic that it is green and it is sweet smelling. When I was going through microbiology and we had agar plates of Pseudomonas aeruginosus, what it smelt like to me, and everyone has kind of their own descriptor of it, like the notes say sweet smelling, but to me, Pseudomonas smells like corn tortillas. I don't know why, but that's what I think about when I think about Pseudomonas. So I may have ruined corn tortillas for you, but it is something that I remember and how I can kind of sniff out, if you will, Pseudomonas when we have trach patients or patients that may be developing this infection. Then there's different types of pneumonias. So mycoplasma is the most common cause of atypical pneumonias, and it's smaller than a bacteria and it's larger than viruses. So when we talk about atypical community-acquired pneumonia, your mycoplasma, come on, get it out. Your mycoplasma is the most common cause of this atypical pneumonia, and the bacteria itself, or the mycoplasma, it's not a bacteria, it's actually smaller than a bacteria and larger than viruses. So it escapes identification from bacterial tests. You have to have a moderate amount of sputum for you to recognize or for you to be able to identify this actual source of pneumonia. And you will have an absence of alveolar consolidation, so you won't have your typical large amount of or moderate or even copious amount of secretions, and your white blood cells will only increase moderately, and there's really a lack of alveolar fluid. So the respiratory symptoms are mild. You can have other non-respiratory symptoms like headache or fatigue or even diarrhea that is a type of community-acquired pneumonia that you might see. When we look at the mycoplasma, some of your early signs that you would see are chills and fever. As far as your x-ray, you might see some patchy infiltrates that change the alveolar septa. So you might see some inflammation in the alveolar septa and the pulmonary interstitium. The patient usually has a dry, hacky cough, and they're only able to produce small amounts of white sputum. They typically have more non-respiratory issues, so nausea, vomiting, diarrhea, weakness, chills, fever. Kiddos that have this mycoplasma, they are highly contagious in high traffic areas. So when kiddos go to daycare or when kiddos go to school, those are high traffic areas where this can be passed around quite easily. But it's typically known as walking pneumonia, is this mycoplasma. Other atypical pneumonias, we have a whole list here. We're not going to delve into each one of those, but your first two are types of bacteria, and then we get into different viruses. So you have a whole list of different atypical community-acquired pneumonias that are there.